Hello, I'm Abigail Jones, a consumer health librarian with 18 years of professional information searching experience. I'm happy to be here to share with you how to make the most of searching for health information on the internet. My objectives are to help you learn tips and techniques to find trustworthy health information online, and by trustworthy, I mean unbiased, scientifically proven, evidence-based information. This is health information that is proven over time. I want you to understand how to evaluate a health information website. And finally, I want to identify with you where to find helpful online health information. My goal is for you to take away 4 principles of healthy web surfing, as well as to share with you some resources to help you get started. Knowing how to find trustworthy health information is important because of where we find health information. According to the most recent research published about information searching habits of Americans, 81% of us use the internet. Well over half of us look online for health information, and over a third of adults figure out their medical condition by looking online. So that last statistic bears a little caveat or a warning. We don't want you to avoid seeing a healthcare professional about a medical condition, and we don't want you to go online and search the internet to figure out what ails you. But there is nothing wrong with self-education. Our purpose is to help you find health information that will enhance your conversation with your healthcare provider, and as well help you to better understand a medical diagnosis, a medicine, or a treatment. So let's start with the first takeaway principle of healthy web surfing: authority. By this I mean evaluating the credentials and reputation of the website and its creators, whether or not they are considered authorities in their fields. We can divide the criterion of authority into 2 categories when evaluating websites. The first category is what and who created the website, and what are their credentials. Usually, an authoritative website has a section labeled About Us or About the Author. This is often on the home page. The second category concerns the website's domain label. Consumer health librarians have found that non-commercial websites, free of advertising, are the most objective and impartial. Therefore, look for website addresses that end in domain labels such as .gov, which is a U.S. federal government website, or .edu, institutions of higher learning, such as a university, which include academic medical centers, and .org, which are for nonprofit organizations. So looking for elements of authority is the first step in healthy web searching. The next one is bias. Bias is the second takeaway, and I should say a lack of bias. Ask yourself, why does the website exist and for whom? Can you identify the purpose of the website from its language? Is the purpose to teach, to entertain, to inform, to persuade, to sell? All of these are valid purposes for websites. But when it comes to reliable, online, objective health information, a website's purpose should be primarily information and education. So consider, what's the agenda or the point of view of the website? Is the language objective and impartial? Watch for advertising or marketing that's attempting to sell ideas, products, or services. One way to learn about a website and its point of view is by reading the mission, vision, and values of the website. So far, we know that a website's authority and bias influence its reliability. Let's look at the third takeaway principle of healthy web searching, which is content. Content has to do with the information in and the design of a website. Ask yourself if the website is easy to use and to navigate. Can you get around it easily? Is its appearance logical and easy on the eye? Is it obvious how to move from topic to topic so you can gain understanding? Health information on the website should be written in plain, everyday language. Some people call this consumer health information. The health information should be translated across from professional medical language to ordinary language that the average adult can understand. If there are medical terms that most people wouldn't know, those should be easily defined and explained. Also important is that the health information is based on proven science. This is called evidence-based information. You should be able to find this information on a reliable health information website, and you should also be able to find the resources that the website organizers use when they cite facts. A website with good content is one where the health information is both scientifically proven and easy to understand and navigate. Once you have explored such a site, your questions should be answered, and most importantly, and I'm going to emphasize this here, the website should refer you back to your healthcare provider for further conversation. The fourth takeaway principle of healthy web surfing is currency. Health information can become outdated quickly. It's important to find current information. How current depends on the topic. For example, if you're looking for health information about recurrent brain cancer, you probably want to look for health information that's been written and published in the last year, and then proceed by looking for health information in the previous year and the year before that, until you find something that helps you understand the topic. On the other hand, there are many health topics where you're looking for maybe coping or patient-to-patient support, information that may have been written several years ago, but nonetheless is still helpful. So use common sense about currency when you're looking for health information. In addition to timely information, other things to be aware of include checking to see if the links and pages on a website are functional and actually working. If they aren't, I would question how relevant and cared for the website is. Often a website will have a copyright date on its home page, which indicates not only current ownership, but also that the site owners are monitoring the content for the year provided. It's not unusual within a health information website for subsequent pages to be dated differently, and that's because some of the information may still be relevant and up to date, but written perhaps in the previous year or even the year before that. As long as the front page, the home page of the website, indicates a current year range, then you can probably be rest assured that the website monitors are checking and updating information as needs be. And that's why on a health information website, you'll often see subsequent pages that might say last updated on or revised on, and then give a date. You may be new to web searching and wondering where you can start. I prepared this slide to show you some resources as a way to get started, and I'd like to demonstrate what these are. The links to these resources will be below this video when we upload this to our channel, and so you can rest assured you can get to them. The first one is to online health information resources. This is a curated list that we prepared here at Ohio State of different freely accessible consumer health websites that we believe meet the criteria that I've discussed today. They're categorized by diseases and medical conditions, as well as some of the other areas that people looking for health information might be interested in, such as a category for health insurance. The next three resources, cancer internet resources, nutrition internet resources, and health information websites, are all pretty similar. I'll show you one of them. Nutrition information resources, or nutrition internet resources, is a handout that we prepared at the medical center, which reminds you of some of the principles that I've talked about today, and then has live links to websites that we believe meet the criteria for healthy web searching. These handouts are distributed here at the medical center, but you have access to them simply by linking out on the web page. There is a consumer health library at the medical center that is open to everyone, open to the public, and you can contact us by visiting, emailing us, calling. It's all confidential, and the staff will prepare answers to your health information questions that you can take to your doctor, your other healthcare providers, and have, we hope, a better, more informed conversation. And finally, the last resource is about the Patient and Family Resource Center, which is a center on the ground floor of the James Cancer Hospital that provides support, education, and comfort services to patients and visitors. It's a new center, and you're very welcome to drop by or call them and find out more information about it. So I'm going to leave you now with a little bit of a summary. To find accurate, up-to-date, easy to understand online health information, remember to follow the ABCCs: authority, bias, content, and currency. Use trusted resources from professionals. And finally, because we love to answer your questions, ask a librarian. Thank you.